Hi everyone, my name is Dr. Bertha. I work with Zuri Health. I just went for this month of January. I want to take you through the thyroid, some of the diseases you might have, and how we can be able to protect ourselves from those diseases. So the thyroid, you might ask yourself what it is. The thyroid is a gland. It's a very small gland. It's normally found just below our Adam's apple. It's butterfly shaped. The main role of the thyroid is that it produces three hormones mainly. We have T3 and T4. Do not look for the main name. It will just confuse you. And we have calcitonin. So T3 and T4 normally do a lot of work in our body, mainly affecting our metabolism, affecting our energy levels, affecting our mood. But for calcitonin, it works mainly in making sure that your calcium levels in your blood is normal. So let's go with the T3 and T4 because that's the main thing that we want to talk about today. So with T3 and T4, your thyroid hormone produces it mainly, the only one that produces it. It can either be overproduced or underproduced. When it is overproduced, we call it hyperthyroidism. And some of the causes of this could be if you're having an extra thyroid nodule, and it's just like a little mass that is causing it to be extra produced. If you're having something like Graves' disease, causing the thyroid to also overproduce the thyroid hormone. There's also something like an inflammatory disease called thyroiditis, very fancy name. Let's say the inflammation of the thyroid causing it to be overproduced. The other thing is underproduction, also known as hypothyroidism. With hypothyroidism, it means your thyroid hormone is not producing as much as it's supposed to be produced. We have things like Hashimoto's disease. That is just an autoimmune disease that will cause your thyroid to decrease the amount of thyroid hormone it's producing. We have other things like radiation. If you had gone for any radiation therapy in things like cancer treatment, especially around the neck, would cause underproduction. And the other thing we have mainly is if you had the surgery done where we removed part or a whole of your thyroid, will also reduce the amount of thyroid hormone that is being produced. So how can we find out if our thyroid is healthy? There's some symptoms that you will notice. For hyperthyroidism, think of yourself as being hyperactive because you're producing excessive. So a lot of sweating, very difficult sleeping, that's insomnia. You will not sleep. You'll be experiencing like in a manic episode. You just never sit it down, right? And then now we have hypo. Hypo is the exact opposite of hyper. In this one, think of someone feeling depressed. There will be cold intolerance. They cannot handle the cold at all. The other thing this patient will be doing is they will gain a lot of weight. Hypo, gain weight. Hyper, lose weight. Again, affects our metabolism. The other thing that we want to know about thyroid is how do we test it? During your annual wellness, I hope everyone does their annual wellness, the thyroid function hormones is one of the tests that we normally check. This one will check your TH, which is one of the thyroid stimulating hormone, your T3 and your T4, partly to check how your hormone levels are doing. Doing this annually can really help you. You might not have the symptoms, or you might have the milder symptoms, and you might not be able to know. And instead of waiting for this disease to become extremely big and now we are struggling and spending a lot of money on it, a simple annual wellness really helps us. So remember, book your thyroid wellness today with us at Zuri Health. You'll be able to do it and save your money tomorrow. Thank you.